But what I will do is tell you, actually, I'll go back, tell you a little bit about why and how I got involved in doing the work that I'm doing in the way that I'm doing it. And how's the speed of my talking? Am I about right? Do you need me to slow down? Do you need me to speed up? You all speak wonderful English. I'm so impressed. I speak zero Dutch. And I understand that liberation sounds best in your own language. And so my apologies for my ignorance of your beautiful language. But let me know if I talk too fast, because I get excited and I talk too fast. Just give me the slow down hands and I'll slow down. So I'm going to talk a little bit about how I came to the work. And then I'm going to introduce you to the 3 cases that I covered in my reporting. And I'm going to do that. I'll give you a very short overview of how the technology works, but I'm mostly going to introduce you to the people who are most impacted by these tools. So I started each of the cases in my book from the point of view of families and individuals who see themselves as targets of these tools. And that created a real shift in the kind of stories I can tell. And then if we still have time, I'll just sort of lay out sort of 3 big ideas that I think are important and interesting across the book. So I came to this work as from a social movement place. I was a longtime member of both the community technology movement and community media movement in the United States from the early 90s on, and also starting about 2000. Part of the welfare rights movement in the United States, or the Poor People's Economic Human Rights movement in the United States. And one of the key sort of origin moments in this work for me is that I was working as a graduate student with a community of women who lived in what basically we call a single room occupancy hotel in the United States. And that basically just means floors of single rooms with like a kitchen and a bathroom sort of down the hall, shared kitchen and bathroom down the hall. So sort of a boarding house that is housing for very low income, poor and working class women in my hometown of Troy, New York. And one of the things we did there was collaboratively develop a number of technology resources. So we created a technology lab for folks to use. We also created a sort of resource directory, and we worked on a simulation game. We did a number of different things. But one day I was just sitting in this tech lab with one of the folks I worked with. We were kind of just talking, just sort of chit-chatting in the morning about life. And there's a card in the United States called Electronic Benefit Transfer Card, or an EBT card. And that is the card that you get all of your public service benefits on. So if you get cash assistance, it goes on the card. If you get food stamps or nutrition assistance, it goes on the card. So they're called EBT cards. And they were fairly new in New York State at the time. So I was talking to this colleague of mine who goes by the pseudonym Dorothy Allen in my book. And I was talking to her about our EBT card. And I said, oh, these are pretty new. I've heard from some people that they really like them, that there's like less stigma when you go to the grocery store because you're not pulling out like paper food stamps the way you did in the past. Like they're a little bit more convenient. They're a little bit more efficient. And she said, well, yes and no. And we kind of talked about that for a minute. And she said, but really the most important thing is that my caseworker, who oversees my social service case, uses the digital record from my EBT card to track all of my purchases and all of my movements. So I'll go into the office to talk to my caseworker, and my caseworker will say, like, why are you buying groceries at the corner store? Don't you know they're more expensive? You can make your money go farther if you go to the grocery store. And I must have had this really shocked look on my face as someone who had not been on food stamps myself, because she kind of laughed at me for a long time. She just sort of keeled over backwards and started laughing, and laughed for like a solid 3 or 4 minutes. And then she kind of patted me on the knee and got a little quiet. She's like, oh, Virginia, you all should pay attention to what's happening to us because they're coming for you next. So this is 19 years ago. And Dorothy's voice is really always in my head when I start to do this work. And this is really a question about, where do you start this work? Do you start with engineers and designers? Do you start with policymakers? Or do you start with the folks who live in what I think of as low rights environments, where there is little expectation that their rights will be respected? So one of my earliest pieces in this in the journalistic part of this effort was an article called "Do You Want to Know the Future of Surveillance? Ask Poor Communities." And my argument in that article was that poor and working class people are already living in the digital future in the United States, and that if we want to know what the shape of digital surveillance might be in the future, that's who we need to ask. So Dorothy's voice is always in my head when I'm starting projects, both because I think it was an incredibly generous thing of her to care that the things that she was already living through were going to come for other people, and for that to be something that she cared about was actually very generous. But also because it gave me a sort of marker of where to start the kind of stories that I tell. So it was really the beginning of the research that began this book, Automating Inequality: How High-Tech Tools Profile, Police, and Punish the Poor. And in that book, I tell 3 stories. The first is an attempt to automate all of the eligibility processes for the welfare programs in the state of Indiana. So that's cash assistance, a program called TANF, food stamps, which we already talked about, and Medicaid, which is a health insurance program for poor and working class people. This is something that often doesn't translate to a European audience. So in the United States, if you don't have employer purchased health insurance, you don't have health insurance, and you don't have access to medical care unless you're so poor that you qualify for a program called Medicaid. There's also a program called Medicare, which is for elderly people. And this is how you can remember the difference. In Medicare, we care about elderly people. Medicaid, we aid poor people. So that's how you can remember the difference. That's how I remember the difference. Medicaid, food stamps, and cash assistance. There's this attempt to automate the eligibility systems for them in the state of Indiana. The system basically moved 1,500 local public employees from county offices across the state into private regionalized call centers and required applicants to apply online for public assistance. The major change in this system was that it shifted the way the casework worked. It shifted it from being a family-centered system where you had a caseload of families you were responsible for to being a task-based system where caseworkers were only responsible for a list of tasks that dropped into their computerized workflow management system, this sort of queue in their computer. What that meant from the point of view of caseworkers is they no longer developed relationships with families, and they rarely had any kind of context for what was going on in their community. So in the past, if you didn't qualify for food stamps, say, your caseworker could say, oh, it looks like you're not going to qualify for food stamps, but there's a food pantry in your town. It's open Tuesday evenings. But that's something you can't do if you're in a regional call center and people are calling from places you've never heard of. From applicants' point of view, it meant that there was very little help for getting through the entire application process, which is actually very complicated and very difficult, requires a lot of sort of external documentation. So there was no one who was responsible for a case from beginning to end. So any kind of mistake that happened with the application was seen as the fault of the applicant and as the responsibility of the applicant to correct. And the upshot of this is the system denied 1 million applications for public assistance in the first 3 years of the experiment. It was a 54% increase from the 3 years before the experiment. And I just want to introduce you to one of the people who was affected by this. And if you'll tolerate it, I'll just do a very brief reading from the book to give you a sense of what the book sounds like. So in the fall of 2008, Omega Young of Evansville missed an appointment to recertify for Medicaid because she was in the hospital suffering from terminal cancer. The cancer that began in her ovaries had spread to her kidneys, breast, and liver. Her chemotherapy left her weak and emaciated. Young, a round-faced, umber-skinned mother of 2 grown sons, struggled to meet the new system's requirements. She called her local sort of county help center to let them know that she was hospitalized, so she couldn't make a telephone appointment to recertify for Medicaid, but her medical benefits were still cut off for failure to cooperate in establishing eligibility. And this was sort of the catch-all reason that these applications were denied, was failure to cooperate in establishing eligibility. Because she lost her benefits, Young was unable to afford her medications. She lost her food stamps. She struggled to pay her rent. She lost access to free transportation for medical appointments. And Omega Young died on March 1st, 2009. On the next day, on March 2nd, she won an appeal for wrongful termination, and all of her benefits were restored. The second story I tell in the book is a story about the coordinated entry system in Los Angeles, which proponents call the Match.com of homeless services. What the system is intended to do is basically rank on a scale of vulnerability. Los Angeles County is 58,000 unhoused people, so there's an incredible housing crisis in Los Angeles. I live in a small city in upstate New York. My entire city plus 8,000 people are homeless in LA. And 75% of those people have no shelter at all, so no emergency shelter. They're living in tents and encampments on the street and in their cars. So this is an extraordinary problem, and it's understandable that people are searching for ways to be more effective and efficient in how they're sharing resources. So this system basically uses a survey with a terrible acronym. It's called the VI-SPDAT, the Vulnerability Index and Service Prioritization Decision Assistance Tool, VI-SPDAT. So the VI-SPDAT, you know what, I'm not going to go through the points one-on-one. I'll just do them while I'm talking about the cases. The VI-SPDAT puts unhoused people on a spectrum of vulnerability, 17 being very vulnerable, 0 being not very vulnerable. And it is intended to match people by their score with the most appropriate available housing resource. So as of the writing of the book, they had managed to survey about 39,000 people for this tool, and they had managed to serve or provide resources to about 9,000 people. And provide resources doesn't necessarily mean that those folks got housing. It can also just mean they got a little bit of help avoiding an eviction, or they, the state rented them, gave them a bus ticket so they could move to another city because they had family there. So any kind of resource is counted as a match in this system. But one of the things I was really interested in this system was those 30,000 people who had gone through this process but had not gotten any resources. Really interested in what their experience was. Their experience, largely, folks explained to me, was that they felt like they were being asked to incriminate themselves for a slightly higher lottery number for housing. And this was actually not a bad analysis of the situation. So the VI-SPDAT, because it surveys people in terms of their vulnerability, asks some very invasive, very personal questions. So it asks if you're currently trading sex for drugs. It asks if somebody out there thinks that you owe them money. It asks if you've been a victim of violence, sexual or otherwise. It asks if you've thought of hurting yourself or someone else. It asks if there's an open warrant out about you. It asks where you can be found at different times of the day. And they ask if they can take a picture. And because they use a system called the Homeless Management Information System as the database that much of this information sits in, which is a federal system, under federal data regulations in the United States, information from the HMIS system is available to law enforcement with no warrant at all, so no oversight process. It doesn't have to be a written request. A line officer can just walk into a social service office and ask for information out of the HMIS. They can't get any information they want. They can only get limited information. Like, they can't walk in and say, run a query on everyone who said yes to, are you trading sex for money, and give us a list of names. They can't do that. And they can request the information, but the social service worker is not required to give it to them. And I think that's important to say. But the reality, the analysis that unhoused people who I spoke to gave me was their concern was that this system was being used to criminalize them. And it's a really common experience for unhoused people in the United States, because basically any kind of daily activity that you do when you're homeless is basically illegal and you can get ticketed for. So leaving your stuff on the sidewalk, sleeping outside, being in a park after it closes, going to the bathroom, like all of these things can end up in a ticket. Because you're homeless, you don't have the money to pay the ticket. The ticket turns into a bench warrant. The bench warrant turns into arrest. You can't pay cash bail to get out of jail before your trial, so you end up in jail until your trial, at which point they say, you're homeless, this is ridiculous, leave, and you leave. So this is a really common process for unhoused people in the United States. And the folks I spoke to in Los Angeles were really concerned that this system would play a similar role in their lives. And I just want you to meet one of the people from Los Angeles. How's our energy doing? People still okay? You got like 5 more minutes, maybe 10 more minutes in you? How are we doing on time? Doing okay? Okay. Because I want to introduce you to Uncle Gary. So one of the folks I spoke to in Los Angeles was a guy who goes by the nickname Uncle Gary. He lives in Skid Row, which is one of the most famous sort of homeless encampments in the country. There's anywhere between 3,000 and 5,000 people who live on the street and the sidewalks of Skid Row, and he's among them. So Uncle Gary Boatwright, when I met him, he was living in a gray and green tent on East 6th Street on the edge of Skid Row in Los Angeles. He's a straight-talking, wryly funny man with thinning white hair and Santa Claus blue eyes. He's had a dozen careers: welder, mason, paralegal, door-to-door salesman, law student, and most recently he was a document processor for a wholesale mortgage lender. And there's actually a lot of irony there, because the company he worked for was partially responsible for the subprime mortgage crisis that created the recession of 2008. So since moving to Skid Row several years ago, Gary's filled out this VI SPDAT survey 3 times. And by the time I met him, he had lost patience with the process. He doesn't think he scored very high. He's 64, and other than a little high blood pressure and a hearing problem, he's mostly healthy. His substance use to me didn't seem abusive or debilitating. He has a mental health diagnosis, but he only learned this when he went to court in Orange County. So the judge told him he had a mental health file, that he had a diagnosis of being mentally ill, but no one ever shared his diagnosis with him. So the problem, as he sees it, is not his comparative vulnerability compared to the other folks living in Skid Row around him. It's simple math. There's not enough housing in Los Angeles for the city's 58,000, for the county's 58,000 unhoused people. And so he told me, this is a quote, "People like me who are somewhat higher functioning are not getting housing. It's another way of kicking the can down the road. In order to house the homeless, you have to have the available units. Show me the units. Otherwise, you're just lying." So in November 2016, as I was finishing the book, Gary was arrested, and he was charged with breaking the window of a public bus with a plastic broom that he bought for 99 cents, which when he called me from Men's Central jail in Los Angeles in the city, he said was, quote, "physically impossible." This is a very not sturdy plastic broom, and he somehow broke the window of a public bus with it. And so he got out about a year ago, and when he got out, he had lost everything. His tent, his paperwork, his relationships with local organizations, his friends, his network. And he will, if he decides to engage with the VI SPDAT again, take the survey again, he'll actually score lower because the system counts incarceration as being housed. So the model will actually see him as less vulnerable, and his priority score will slip even further. Okay, so the final case is the most sort of complicated, both ethically and technically, and I don't want to spend a ton of time on it. So I'm just going to give you a very quick overview of it, and we can get into the details of it in the conversation if you'd like to. So the third case that I reported on in the book was called the Allegheny Family Screening Tool. And Allegheny County is the county in Pennsylvania where Pittsburgh is. The screening tool is a statistical model that's supposed to be able to predict which children might be victims of abuse or neglect sometime in the future. The very short version of how it works is that there is the way that you get investigated for child abuse or neglect in the state of Pennsylvania is either a phone call comes in to an anonymous hotline, or a person who's known as a mandated reporter, which is basically anyone whose profession means they interact with kids a lot. Teachers, nurses, sometimes clergy, coaches, are under Pennsylvania law legally required to report any suspicion they have of abuse or neglect, even if they didn't witness it themselves, but they've heard it secondhand. So those are called mandated reports. So either the county office, the Department of Human Services, gets either these mandated reports or these anonymous phone calls come in. And there's a group of people called intake call screeners who make a very difficult decision. They get this report, they read this report, they do a bunch of research in this data warehouse that the county has, and they make a decision about whether they should screen that report in and send investigators to this home to investigate whether abuse or neglect is occurring, or whether they should screen it out, keep a copy of that report, but not investigate it right now. It's not severe enough to really hit the level that they're concerned enough that they're going to investigate it. So what the Allegheny Family Screening Tool does is use this really expansive data warehouse that the county has. It has more than, as of the writing of the book, had 1 billion records in it, which is 800 records for every single individual living in the county. So the model runs, looks at that data, and gives each family a risk score on a scale of 0 to 20 based on their history interacting with county programs. So it shows up on the intake call screener screen as like a thermometer. It's green at the bottom, red at the top, 0 to 20. If the score is high enough, as of now, if it's 15 or above, the system automatically launches an investigation on the family, whether the screener agrees that should happen or not. It can be overridden by a manager, but it does automatically launch an investigation. So there are a number of concerns about this system. From the point of view of parents, people who might be investigated, they're really concerned about false positives problems. Because the system really only gathers information on poor and working class families, it can only gather information when people interact with county services. So if you're a professional middle class person in the United States and you need support with your parenting, which we all need support with parenting, right? It's hard. Professional middle class people in the United States will reach out through private sources. If they need child support, they'll get that from a nanny, or they'll pay for childcare out of pocket. If you need mental health support or addiction recovery support, you'll get that through a doctor, but you'll pay for it with your employer-covered insurance. So that's a private system, not a public system. So really the only people who end up in this database are folks who are asking the state or the county for support, from the state income maintenance, from the county office of mental health, from the county office of addiction. So parents see the system really as confusing parenting while poor with poor parenting. They see it as a system for profiling poor and working class families and seeing them as bigger risks to their children than they actually are. Now, interestingly, the intake call center workers, the screeners, have the same concerns with the data set, but for the opposite reason. So they're concerned that the system, because it doesn't have data about professional middle class people, is unable to see the harms that potentially happen in those families, and will miss harm that is actually happening. So they're concerned about false negatives, not false positives. There are also some reason to be concerned about the proxies that the system has chosen, but let's not go down that sort of technical rabbit hole. We can talk about that later if you'd like. So currently, this system is still in use in Allegheny County. They actually have moved to a level of more technical sophistication in the last year, where they've moved to a machine learning model that is new to them and is still being tested. But I want to introduce you to one of the families from Allegheny County, and then I'll just point up a couple of shared points, and then we'll wrap up and go into conversation. We okay? 3 more minutes? You guys are very patient. Thank you. I don't have a clock, so I've totally lost track of my time. Okay. But it's good to meet Angel and Patrick. One of the families I interviewed when I was doing my reporting in Allegheny County was Angel Shepherd and Patrick Grebe. And I met them at sort of this support center, which is a community hub where families who are interacting with child welfare go for support with their parenting, to attend programs, access different resources, connect with each other, sort of a peer support group. And Angel and Patrick didn't stand out right away because their experience is so utterly average, so characteristic of the routine, almost mundane indignities that are experienced by the white working class in the United States. So they've struggled with low-wage, dangerous work, poor quality public schools, predatory online education, poor health, and community violence. But through it all, they've been very creative, really involved parents. So Patrick is this like enormous man who I think I describe in the book as like a Buddhist ex-biker. He has this really complicated facial hair, and he's just like as wide as he is tall. And they're caring for 2 young girls, Harriet, who is Angel's daughter, and Desiree, who is Patrick's daughter's daughter, so their daughter and their granddaughter. The 2 girls are very close in age, so they bicker a lot, they argue a lot. And so how they've chosen to solve that is in what they call the get-along shirt. And the get-along shirt is one of Patrick's like enormous tent-sized button-down shirts. And they put both the girls in the shirt, one arm through the armhole, the other arm around the waist of their of the other girl. They button up the shirt, and you're not allowed to leave the shirt until you stop fighting, even if you have to go to the bathroom. And that's the thing that Patrick says always works is as soon as someone has to pee, they get out of the shirt, they stop fighting. So they're these very creative, very engaged parents. But despite that, they're a poor family, and they've racked up a lifetime of interactions with the Office of Children, Youth, and Family Services. So Patrick was investigated for medical neglect in the early 2000s because he was unable to afford an antibiotic prescription for his daughter, Tabitha. So basically, he went to the emergency room with his daughter. They said, you need these antibiotics. He couldn't afford the antibiotics. The infection got worse. He took her back to the emergency room, and the nurse in the emergency room reported him to child welfare for medical neglect. When Harriet was 5, this is about 5 years ago now, someone phoned in a string of reports to this anonymous tip line, saying that she was running around the neighborhood unsupervised, that she was down the block teasing a dog, that she wasn't being properly clothed, fed, or bathed, she wasn't getting needed medication. Because the tip line is anonymous, Angel and Patrick weren't ever able to know who was reporting them. So for each call, an investigator came to the house, interviewed the girls, interviewed Angel and Patrick, looked under in all the cupboards and in the fridge and under all the beds, asked for access to their medical files, and then each time, because they found no evidence of maltreatment, they closed the case. But each of these interactions was entered into the family's case file, which is held in that integrated data warehouse I talked about earlier, which feeds the Allegheny family screening tool, this predictive model. So Patrick and Angel understand that any kind of, anytime they have to interact with the state or the county, that potentially drives their risk score up in the system, and that could potentially result in an investigation of their daughter or granddaughter and possibly removal to foster care. So Angel told me, you feel like a prisoner. You feel trapped. It's like no matter what you do, it's not good enough for them. My daughter's now 9, and I'm still afraid they're going to come up one day, see her out by herself, pick her up, and say, you can't have her anymore. So I just wanted to make a couple of very quick points, and then I think we have plenty to talk about. But the sort of 3 big themes that I think are really important across these 3 stories. One is that these systems don't really make sense out of a political context of austerity. Right? So this idea is that we don't have enough resources for everyone, that we live in a world of scarcity, and that we have to make really hard decisions between people who deserve to be able to access their basic human rights and people who don't. This, I always point out, is actually a political decision. This idea to triage at all is a choice. And actually, when people talk about these systems as digital triage, I think they're using language in a tricky way, because this isn't actually triage. Triage assumes that there are more resources forthcoming. If there aren't more resources forthcoming, what we're actually doing with these systems is rationing access to people's human rights, not triage. The second sort of big point that I think is really important is that we often talk about these tools as being more neutral or more objective than human decision makers. And so in the United States, particularly where all the programs I talked about have really been impacted by a history of racial injustice, there are often arguments that we should be using these technologies to push back against racial and economic bias in public services in the United States. Bless you. The reality, though, is that these systems have bias built into them from the beginning because of things like limitations on data sets. If data is only collected on poor and working class families, that's going to reproduce bias. If, for example, in Allegheny County, they've been very specific about saying they hope that this system can help them identify patterns of discriminatory decision-making by those call screeners. But the reality is racial bias is actually entering that system much earlier. It's entering at the point at which the community calls on families, those mandated reports and those anonymous calls. And actually taking discretion away from those frontline caseworkers can actually make racial bias worse. And finally, the sort of third point is my greatest fear about these systems is they potentially act as a kind of empathy override. So in Los Angeles, they're facing a very real, horrifying situation. If anyone has spent time or even watched videos of the homeless encampments in Skid Row or South LA, they're extraordinary places in a lot of ways. And this is a human rights tragedy at an epic scale. My concern, though, is by using this sort of moral diagnostic, by using these systems as moral thermometers that say, oh, these people deserve help because we have to triage, and these other people can wait, or maybe they don't deserve help, we create a moral hierarchy that undercuts our ability to make an argument that there's a certain level or a certain set of basic human rights that everybody deserves access for and that you can't lose access to for any reason. And I believe housing housing, food, and medical care are among those things. So my concern is that these systems act as a way to avoid some of the most important political conversations we need to be having by creating this moral thermometer that allows us to escape our responsibility to care for each other. So many of the things that I describe in the book in the United States, we describe as systems engineering problems, right? That the problem is resource allocation or the problem is getting information where it needs to go. The reality is that they're human rights violations. This is a very different way of thinking about these issues. So my goal is to help people think about solutions to these problems that are simultaneously cultural, political, and technological solutions at the same time. Because I don't think that these are primarily technological problems, though I do think that the systems we're building are machines for making political decisions. So we have to do this work on multiple levels at once. And I'm happy to talk about solutions more as we get into conversation. So thank you so much for your attention, for your patience. And I'm excited to have this conversation. Thanks.